Hi, my name is Grace. I had sections 5.5, 5.6, and 5.7, so I'm just going to kind of go in that order. So for 5.5, which is about the pulmonary and circulatory pathways, I'll go ahead and start with that. The pulmonary circuit is a circulatory pathway that consists of the pulmonary trunk, the pulmonary arteries, and the pulmonary veins. It takes oxygen-poor blood from the heart to the lungs and oxygen-rich blood from the lungs to the heart. Systemic circuit includes blood vessels that transport blood from the left ventricle back to the right atrium of the heart. The major arteries of the pulmonary and systemic circuits are the aorta, common iliac, common carotid, subclavian, renal, inferior mesenteric, and the femoral artery. The major veins of these systems are the external jugular, the internal jugular, subclavian, renal, mesenteric, common iliac, femoral, and the gray saphenous vein. In the pulmonary circuit, blood is oxygen poor. In the pulmonary arteries, while blood is oxygen rich in the pulmonary veins. The arteries and veins not included in the pulmonary circuit fall into the systemic circuit. These veins and arteries carry blood high in oxygen to the veins, and the veins carry lower oxygen dense blood. The hepatic portal system consists of the hepatic portal vein and the hepatic vein. The hepatic portal vein consists of blood vessels that transport blood from the left ventricle and back to the right atrium of the heart. The hepatic vein is the vein that runs between the liver and the inferior vena cava. The purpose of this system is to drain blood from the capillary beds in the digestive tract in order to allow the liver to manufacture blood proteins. This also allows the liver to purify the blood of toxins and pathogens that enter the body. So now I'm moving on to section 5.6, which is all about the movement of fluid across the capillary walls and how that's done. The two factors that mainly control the flow of fluid across the capillary walls are blood pressure and osmotic pressure. Blood pressure causes fluids in the blood to move between the capillaries in between tissue spaces. Osmotic pressure allows water to move in the opposite direction. This happens because blood pressure is higher than osmotic pressure, so water is forced to exit the arterial end of the capillary. Midway through the capillary, blood pressure is lower, so it's around the same pressure as osmotic pressure. So this cancels out both of those forces, and there's no movement of any fluid. At this point, this allows any nutrients in the fluid to diffuse into the capillaries. Red blood cells and plasma proteins stay in the capillaries during this time, while substances that leave the capillaries contribute to interstitial fluid. So this is excess fluid that leaves the capillaries, and it is also known as lymph. Lymph is fluid derived from the interstitial fluid. Lymph is returned to the systemic venous blood afterwards. And I'm going to move on to the next section, which is 5.7. This is all about cardiovascular disorders and everything. So some of the most common cardiovascular disorders are hypertension, atherosclerosis, thromboembolism, stroke, angina pectoris, heart attack, and aneurysm. Hypertension is elevated blood pressure, and you can usually see that through diastolic blood pressure. Atherosclerosis is a condition in which fatty substances accumulate on the inner linings of the arteries. Thromboembolism is the obstruction of a blood vessel by a thrombus that has dislodged from the site of its original formation. A stroke is a condition resulting when an arteriole in the brain bursts or it becomes blocked by an embolism. Angina pectoris is a condition of thoracic pain, so like right here, and it's from occluded coronary arteries. Basically, this can happen before a heart attack. That's kind of the pain that people get before they have a heart attack or during. A heart attack is damage to the myocardium, which is basically the heart, due to blocked circulation through the coronary arteries. It's also called a myocardial infarction. And an aneurysm is the sac-like expansion of a blood vessel wall. So for cardiovascular disease, also known as CVD, some people are predisposed to it. So some people have a higher risk of it if they have a family history of heart attacks under the age of 55, if they're male or African American. Some things that definitely don't help with getting CVD are smoking, drug abuse, and being extremely overweight. While you can be predisposed to it, there are a lot of medical advances that have treated people for these disorders. For example, thromboembolism can be treated through dissolving blood clots, and clogged arteries can be treated through bypass surgery, which is basically done where the end of the aorta is stitched to a part of the coronary artery that is not clogged, so it allows for that blood flow to continue. And an angioplasty can treat clogged arteries by threading a plastic tube through a major blood vessel toward the heart, and then a balloon at the end of the tube is inflated and it forces the blood vessel open. I hope I covered everything. I'm going to try and put some visual aids in, one for each section, and as far as my sources, I'll include this as well, but I just used the textbook for this. So, thank you.